Authorities in KwaZulu-Natal have confirmed that floods in the province have killed 5 people, including a child. SABC News reporter Nonhlakanipho Magwaza is in oThongathi for us, and she joins us now. Very good afternoon, Nonhlakanipho. Tell us more.
Good afternoon, and to the viewers at home. Yes, we are here at Magwaveni in oThongathi, which is a semi-informal settlement with also formal houses here in the area. Earlier on, we did go around the area looking at the area here in oThongathi, and we saw a trail of devastating destruction wherever we went. Coming here to Magwaveni, the road is inaccessible because of the transformers that have fallen on the road, as well as trees and debris. So government or officials are trying to remove those so that this place can be accessible here. But with me now is MEC of Health, Ms. Nomagugu. She will be telling us more about what exactly is happening in the health sector, as we understand that there are 7 people who have been confirmed deceased, and quite a number of people who are currently in clinics and hospitals. MEC, thank you so much. We do understand that still currently people who are still in our clinics and hospitals. If you can just take us through the influx of people and whether or not there are some clinics in the area that have been damaged by the storm.
All right, no, thank you very much. Firstly, I think I want to send condolences to the families that have their loved ones who passed on. We really do feel their pain. I mean, we are standing here, we are right in the midst of devastation. There is not a single household that has not been affected. So it really is a very difficult situation that this community is facing. In terms of the facilities that we have, our own facilities at the Department of Health, we have not received a report on any that has been affected. There is a CHC that is not very far from here. Definitely it has not been affected in terms of the tornado itself. Probably it's because it's about 10 or so kilometers away from the area, so it was not on the way of the tornado. With that said, we had an influx of about 120 patients yesterday that came into the CHC, and because it was already in the evening, and the staff, in the evening the staff is not the same amount as in the morning, so we had to recall the staff that had actually knocked off, and we do appreciate that all of them came back and actually were committed to doing their work. But that on its own was not sufficient. We then had to add staff from other facilities and add teams to ensure that they are able to assist all the people who were in the facility at the time. With that done, we then also decided that we are going to utilize 3 facilities in terms of hospitals, which is General KZN Hospital, Pixley Isakaseme Memorial Hospital, and Victoria Mxenge Hospital, which was King Edward. So all of those that were seen yesterday and needed to be transferred for higher care have been sent to these 3 hospitals. But as of this morning, we've also again had an influx of people coming in now with minor injuries, and as of 11:30 this morning, we had seen about 69 patients, new patients that were coming into the hospital. But most of them are just with minor injuries. We have one that we're a bit worried about. We think it might be a fracture, and we will be referring to a higher care. But all the other 69 have been treated and have been discharged. We are very much aware again that, because people have been working at home trying to secure their possessions, some might not realize how injured they are. So throughout the day, they will still be coming in. In terms of numbers of the people who deceased, we don't want to commit ourselves as the Department of Health, because we don't get all the people that pass on into the facility. We can only tell you about those that passed on in our facilities, but the province will only be able to announce once we, as the Department of Health and the police, have been able to reconcile the numbers.
Thank you so much.
Thank you, sister.
That was Health MEC, Ms. Gugu Simelane.